If your earlobes are split, stretched, or just sore from old piercings, you're not alone. The good news is these little lobe issues can be fixed pretty fast and without major surgery. This morning, plastic surgeon Dr. Michael Kim is here live in the studio breaking down some quick, simple earlobe repairs that you're going to want to hear about. Dr. Kim, thanks for being here.
Morning. I take a second to say happy birthday. My daughter turned 17.
Absolutely.
And my
happy
dad
birthday.
turned 92.
92. That's awesome. Boy, this is a big week for you guys.
Yeah.
That's awesome. What's not awesome is when you have kids and they pull your earrings out. I've had that happen before. I know a lot of moms have, or you have those gauges and they overstretch.
Yeah, the reason I brought it up is it's amazing how many people come in for earlobe repair and they never realize that it could be fixed. Walking around for years with split earlobe and like, oh, I didn't know you could do it, and I didn't know you could do it in the office, and I didn't know I could drive and just do it under local, and blah, blah, blah. So I just want to inform people that earlobe injuries are very common, but they're relatively easy to fix.
Okay. What all do you do, I guess? What is the process if you would like to get yours fixed?
Well, I think that basically there's several issues. One is a torn earlobe.
Okay.
Or a partially torn earlobe where it's so stretched and the hole is so big, like here, like gauging, that you can't wear regular earrings anymore. They fall right out.
Right.
This is a complete split there, you can see. And then, of course, there are piercings. Sometimes people want the holes fixed. But all these holes, per se, wherever they are, usually in the ear, can be fixed surgically under local anesthesia. Basically, you just numb up the ear. You have to cut the skin out that's already healed and then sew it together. You can't just sew it together because there's skin on the inside of the hole.
Oh,
so if you send skin, the skin will not stick. That's why I kind of chuckle when I went online about all these non-surgical glues you can buy or lotions for split earlobe repairs, usually from out of the country.
So not safe at all.
But yeah, there's basically, I think the only chance it might help is if you have acute tear and you superglue it.
I see.
Something that you rip it and you superglue it right away. But generally speaking, these are slow stretches. Tore a while ago, they heal up, and now you got a big hole or no hole. So they do have to fix it.
What is this one with the cell phone? Oh
well,
my gosh.
That's crazy. Yeah. So gauging luckily is becoming less popular, but I think the irreversible, no turning back hole size is what they call a 00 gauge, or about 10 millimeters, which is a little less than a half an inch.
Okay.
So if you stay below like a 0 gauge, which is small, like 7 millimeters, usually the holes will fill in by itself.
Okay.
If you take them out. But if you go bigger than that, then you got to go and come see me and have it fixed.
So I would assume, what, skin graft, or how do you?
No, you just cut out the gauge. Usually it's stretched skin, so you have to remove a little extra skin.
Okay.
Sew it together, make a nice earlobe again. I've had gauges everywhere on the ear, and they're relatively easy to fix.
Okay, what about the cartilage piercings? You know, you see those, some people with, and actually some of the examples you showed, holes in your cartilage. Does that heal?
Yeah, generally speaking, I don't see a lot of gauging through the cartilage, but cartilage usually you don't have to fix. So if you have like a laceration to the earlobe, if you repair the skin on both sides, it heals fine. So you generally do not have to repair the cartilage. If you're missing cartilage, you can still repair it and have a little soft spot.
Okay.
But most of the time, we don't have to do anything for the cartilage loss. Occasionally, if it's a huge area, then you have to graft it from the rib, etc. But generally speaking, we don't have to repair the cartilage.
We both have teenagers. Is there anything you would advise our viewers out there? What should not ever be pierced? What should not be messed with, if you will? Because I know you see it all.
Well, I think genitalia is one area that I see that probably would stay away from. Maybe your oral area, the lip, tongue, those are hard to fix, but you know, some people leave them in for life. Very distracting.
Yeah, very much so.
But in general, as long as you stay small and conservative, it should be fine. You can pull them out. A lot of times they just close up. So just stay reasonable. Don't go too big on the hole. Be careful with trauma. I have young kids get the earlobes pulled out, and then they're like very young, like 6 years, 5 years old.
Yeah.
It's very traumatic to have something fixed like that.
Sure.
So just be careful about earrings, not too big, because they get hooked on things, ripped out, and then you have to see. The other thing is, if you get ripped out, don't go to the emergency room. They're not going to do anything.
Oh, really? Okay.
So let it heal up, call a plastic surgeon, have it fixed. Because I've had several patients that go to the ER, they pay the fee for urgent care, and they end up coming to see me later. So it's kind of, unless it's bleeding massively, it's kind of a waste of a visit because they're not going to fix it.
Okay.
They're going to say, here's a plastic surgeon, good luck.
So it's a matter of calling your offices directly or a plastic surgeon's office?
Yeah,
Okay.
no, and have it fixed usually in a delayed fashion.
Okay. Dr. Kim, thank you so much, as always, and happy birthday to your daughter
Oh, thank you.
and your dad. Those are big milestone birthdays. We'll put information about Dr. Kim. You can visit his office. It is right there in Fort Myers, or you can contact him. There's his website right there on your screen. We'll put information as well on our Gulf Coast News app and our website.